How you doing and welcome in everybody. This is our third installment of the Ask the Pharmacist series for United Patients Group, and we're happy to have everybody in and hope we're getting a lot out of all of this. So today we're going to go over a little bit about the differences between THC and CBD. We're going to go over some interactions of CBD and blood pressure medications and blood thinners. And we're going to also talk about any potential interactions with CBD oil and alcohol as well. So to get us started, the big differences between THC and CBD. This is one of the biggest questions that we get from everybody, and what they do for you and how that differs. So CBD is the one that's available to everybody at your gas station, at your grocery store, and everything else. So that's the one that a lot of people have access to right now, and you definitely see many more products containing it, whether it's topicals or hand creams or soaps or anything. It seems to be infused with CBD oil at this point. CBD is non-intoxicating. It does not get you high. It is good for anxiety, inflammation, nausea. Um, and one of the best ways that I've heard, the effects of CBD is that you don't realize the benefits you're getting until they're gone, especially when it comes to like pain and inflammation, or even anxiety and stuff like that. Because you don't get high, because you don't get that sort of whoosh coming over you, you don't realize the benefits that you're getting from CBD so significantly. And that also speaks to the side effects that you get are pretty minimal to none really from CBD. Maybe a little bit of dry mouth, and it can cause some red eyes, so you do want to be a little bit careful with that too, with the bloodshot eyes. THC is potentially intoxicating, so that can get you high. You want to be careful with that. It's also good for pain, nausea. It can help induce appetite, sleep, and for anxiety as well. Anxiety comes with a disclaimer. THC is what causes paranoia. Too much THC is what can lead to that very, um, you know, bad experience that can lead you to not want to consume THC again. So again, just like we've said in previous episodes, you want to make sure you start low, take it slow, very easy until you can always increase your dose until you get the relief that you're looking for, and really keep those side effects to a minimum. But again, if you're using it for anxiety, you want to be very careful with that, especially with sativas. Any of those really energizing strains, you would not drink a Red Bull in the middle of a panic attack. So those are really not the best strains. You don't need to be happy or energetic or anything in the middle of a panic attack. You want to calm down, relax, and then worry about being happy after you do that. So just a little thought about that as well as you're making your decisions. CBD and drug interactions. So a lot of patients that are using CBD are also taking blood pressure medications, blood thinning medications. So can CBD interact with blood pressure medications? Absolutely, it can interact with them. Uh, I'm sorry. Let's so can you take CBD with your blood pressure medications? Absolutely. CBD is not known to interact with blood pressure medications, and has not been found to cause an increased heart rate or blood pressure increase. THC is usually what has been found to cause the tachycardia, the increased heart rate, potential arrhythmia type of a thing. So that's really where you want to be careful with anybody with high blood pressure medications, or heart issues, anything like that. THC is really what could be the concern there, and you want to keep those doses to a minimum. But CBD has not been found to interact with blood pressure medications. Now, blood thinning medications is a little bit of a different situation. Blood thinning medications, they're at high doses of 300 milligrams or more, according to the Epidiolex studies. It can have blood thinning properties. So it can increase the potency of product medications such as warfarin or Coumadin, and that is something that you want to be careful with. At low doses, at 25 milligrams or so, that's not going to have any interaction. However, if you're taking warfarin or any other blood thinners, you definitely want to consult with your medical provider who's prescribing those medications, just to make sure that they are aware that you've started CBD, so that they can look out for any potential interactions or anything changing within your blood work or anything like that. And then CBD and alcohol. As far as alcohol is concerned, CBD is not a problem. It does not increase, the dizziness, drowsiness effects of alcohol or anything like that. THC can do that. That you definitely want to be careful with. The depressing effects that you get and the additional sedation is definitely something you want to be careful of. But CBD does not cause those issues. The one big thing in general that you want to be careful with CBD when it comes to drinking alcohol is make sure that you stay hydrated. When you're taking CBD, it can dehydrate you. Obviously, alcohol can do the same. So you want to make sure that you're drinking plenty of water and staying hydrated because, especially in the summer months, very hot outside, we don't all drink enough water as it is to begin with. So that's definitely something that you want to make sure that you stay on top of. Other interactions with CBD and prescription medications have been very minimal. Again, if you're taking other prescription medications, you want to consult with your doctor first and just make sure that they are aware that you're taking, CBD as well, so that if they notice anything changing with any of your blood levels or anything like that, they can make the necessary adjustments as well. When choosing a CBD product, you want to make sure that you do check the products as well. Make sure that you check the certificate of analysis, make sure there's not any molds, mildews, heavy metals in there. You really probably don't want to be purchasing it out of your gas station or even your grocery store. You want to go somewhere that has reputable products. So you want to make sure that they have the certificates of analysis and the testing and all the ingredients and everything right on the bottle. If it doesn't have that information, that's a good sign. It's probably not a product you're interested in using, and I would try something else. So choosing your CBD products can be just as important as any potential interactions that you have, because if they have other products in there as well, there is potential for interactions with other medications, those products. So again, thank you so much for joining us for the Ask the Pharmacist series on United Patients Group. If you have any questions, please feel free to send them in. We're always looking for new, different questions to help our patients have better information and be better prepared for each trip that they make to the dispensary and that they take all of their medications safely. Thank you so much and have a great day.